5 alarming signs your kidneys are crying for help. 5 signs your kidneys are crying for help. Did you know that 1 out of every 7 adults in the United States has chronic kidney disease? That's roughly 37 million people, making up 15% of the population. Kidneys are the filtering units of your body. They primarily remove toxins from your bloodstream and keep blood circulating. But when your kidneys can no longer perform their designated role, waste starts accumulating in your body, leading to the onset of various diseases. Today's video will cover the warning signs that your kidneys are in danger. Plus, we'll get to know this vital organ a little better. Is frequent urination a sign of unhealthy kidneys? What about swelling limbs? We got all your questions covered, so let's get started. Do you face trouble sleeping at night? If you often spend your nights in bed, staring at the ceiling because you cannot sleep, you may have a sleep disorder. Studies have shown that sleep disorders are common in those with kidney disease, especially those with end-stage renal disease. End-stage renal disease is an advanced sleep disorder. Kidney disease. Your kidneys will gradually lose function and be unable to meet your body's needs. This will eventually lead to kidney failure. The only way to treat this disease is through a kidney transplant or dialysis, which removes water, solutes, and toxins from the blood. 80% of those experiencing kidney failure report troubling sleep patterns with little or no sleep at night and increased daytime napping, which can decrease sleep quality. But why does that happen? Our body has a circadian rhythm or a 24-hour sleep-wake cycle. This sleep-wake cycle is why you feel sleepy during the nighttime and not the daytime. Your body secretes a hormone called melatonin, produced by the pineal gland and responsible for regulating your circadian rhythm. Melatonin is produced in small amounts during the day and in larger quantities at night. However, melatonin production gets disturbed if your kidneys are not functioning correctly. The sleep-wake cycle reverses and you start producing melatonin in more significant amounts during the day than the night, resulting in your sleeping pattern turning nocturnal. Do you feel worked up? Have low energy levels or have trouble concentrating? If you find yourself constantly yawning, dragging your feet from task to task, and getting upset or annoyed easily, you could be anemic. Anemia is a condition where your body lacks healthy red blood cells, which are essential for transporting oxygen throughout your body. Anemia can trigger a decline in your essential bodily functions, making it hard for you to carry out your day-to-day activities. Now, you may ask, what has anemia to do with this? Weren't we supposed to talk about kidney disorders? As it turns out, anemia has much to do with kidney function. Studies show anemia is a common complication of chronic kidney disease. Around 60% of those with kidney disease have anemia as a symptom. Your kidneys produce an important hormone called erythropoietin, or EPO. EPO is vital in the production of red blood cells. When you have kidney disease, your body fails to produce enough EPO. A decline in EPO levels would mean that your body will make fewer red blood cells, and fewer blood cells, as we mentioned earlier, results in a lack of oxygen to your tissues, equating to anemia. Due to impaired oxygen supply to your bodily tissues, you'll feel tired more often. The same thing applies to your concentration abilities. When your brain and nerve cells do not get enough oxygen, they cannot function properly, causing severe disruptions in your communication channels, making you forgetful and unable to concentrate or think clearly. Next on our list, if you notice puffiness and swelling in your limbs, it's because your kidneys could be the cause. Puffiness in the legs or the sensation of heavy limbs is known as edema. With this condition, fluids become trapped inside your body tissues. Even pressing the skin softly might cause a dimpling effect called pitting because of the appearance of a small hole-like formation on your skin. Edema often makes a sudden appearance and is a vital sign of a kidney condition. Those experiencing kidney issues might be unable to flush out toxins from their body as easily as they would if their kidneys were healthy and functioning normally. A buildup of toxins like sodium in your bloodstream can create undue pressure on your blood vessels. Sometimes due to the mounting pressure, fluid might ooze out and get collected in your body tissues, resulting in swelling. Your kidneys consist of a tiny network of blood vessels called glomeruli, responsible for filtration. When these glomeruli or cleaning units are damaged, you can develop nephrotic syndrome, a kidney disorder that causes your body to let go of more protein than usual. Since protein acts as a water magnet and pulls water into the bloodstream, its deficiency can cause moisture to escape the blood vessels, leak out, and accumulate in the body's cells, which then causes edema. Gravity affects edema. This is why doctors often advise those with edema to keep their feet above the ground, raised on a higher platform. When you keep your feet on the ground, the Earth's gravitational pull will attract more fluids towards itself, resulting in fluid deposits in your lower limbs. This makes your legs a more likely spot for edema to occur. Another way to manage edema is using compression socks that prevent excess fluid deposition. Edema also manifests other severe health conditions such as congestive heart failure, liver damage, deep vein thrombosis, and protein deficiency. You must consult a doctor as soon as you notice your legs swelling up and turning puffy. 4. Your skin is no longer soft and supple. Conditions such as dry and itchy skin are common in those with kidney disorders. Since an impaired kidney can no longer drive out toxins from your body, your impurities accumulate and remain in circulation, leaving little space for nutrients and oxygen to flow. A reduced supply of vital nutrients and oxygen to your skin will make it dry and rough. Symptoms may not be noticeable at first, however, they'll become much more prominent once the disease progresses. Dehydrated skin is common in those with end-stage kidney disease. Your skin becomes so dry that it goes rough and scaly. It cracks up quickly and feels tight. And in some cases, dry skin scales may develop. Moisturizers and healing ointments may temporarily relieve the problem, but the scaliness is likely to reoccur if the root cause isn't addressed. An advanced kidney disorder may trigger itching as well. For some people, itching is contained to your hands, legs, or neck, but in others, it can spread throughout the body. Constantly feeling itchy can irritate you and cause you to struggle in carrying out day-to-day activities. Itchiness can provoke rigorous scratching as well. So, if you can no longer control your urges and have given in to the scratching, bleeding skin or sores can develop and form firm bumps, resulting in leather-textured skin. The long-standing presence of toxins in your body can also trigger a skin color change. Over time, your skin may acquire an unhealthy pale color or gray hue. 5. Are frequent bathroom visits normal for you? When the filtering units of your kidneys become damaged, you most likely have to use the restroom frequently. This is because your kidneys are responsible for maintaining a healthy balance of fluids in your body. When your kidneys are unwell, their regular processes falter and produce more urine than usual. This condition of excessive urination is called polyuria, a common symptom of kidney malfunction. Glomerulonephritis, a disorder where the tiny cleaning units of your kidneys are damaged, can be one of the reasons for excessive urination. While this disease can occur due to HIV, hepatitis B and C, or an infection in the heart valves known as endocarditis, it is mainly a result of the immune system's attacks on healthy body tissue. Mild cases of this disease are easily treatable with medications. However, it can advance and inflict serious damage to the kidneys and cause long-term kidney complications. In severe cases of glomerulonephritis, you may notice blood in your urine. Another symptom of kidney condition is frothy urine, which happens because of excess protein. As mentioned earlier, a kidney malfunction causes the extra protein to circulate in your system, some of which passes down in the form of urine, making it bubbly and frothy. Gradual loss of kidney function can leave you in a tough spot. It's not just your kidneys that are affected. Other vital organs depend on your kidneys to drive out toxins. Do not ignore these vital signs of kidney conditions. Wondering how you can boost your kidneys' well-being and prevent other health disorders? What signs of kidney issues did you notice? Let us know in the comments below.